Hello, everyone, and welcome to Fearlessly Authentic. I am your host, Jody Harrison Bauer, and I am so happy to have you here. I hope everybody had a great celebration. Let's go. I have an amazing guest for you today. But first, if you are a first-time listener, welcome to the show. This is the show that educates, empowers, entertains you a bit, and inspires you to live your most fearlessly authentic life. Because in my opinion, if we are not living our most fearlessly authentic life, then what the heck are we doing here? So I am glad that you are joining me today. And please remember to rate, review, and subscribe. Your ratings, your reviews mean so much to me. You can find me on Apple. You can find me on Amazon Music, Spotify, every place you listen to podcasts. You could also find me on all social media platforms at Jody Harrison Bauer. On today's show, Fearlessly Authentic, I am so excited to share my guest with you, as I always am, because our skincare is so important to us. And so many of us, myself included, are very overwhelmed with what's out there. There are so many trends. Are they true? What are the best products to use? You know, I'm 63 years old. My birthday was the 27th, and your skin changes at different times of your life. And my guest is going to explain everything to you. So stay with me. My guest today is Dr. Mamina. She is an award-winning triple board certified dermatologist and is the go-to expert on beauty and wellness trends, anti-aging, winter skincare tips, and product recommendations. And let me tell you, you are going to get a lot of product recommendations today that are going to help you feel better in your skin. A media personality and influencer, Dr. Mamina has been seen in Cosmo, Forbes, Vogue, and GMA with over 1 million online followers. You can find her at Dr. Mamina. She is incredible on TikTok. Go to see her TikTok right now. Well, after the show, you need to see it. She knows firsthand the emotional impact that skin issues have on a person. Through her journey to becoming a dermatologist, she realized that healthy skin is not just about improving your appearance, but addressing the root causes to give you true control over your wellness. She shares the science behind healthy skin with personalized approach designed to address the root cause of skin problems. Not your average dermatologist. No, she's not. Dr. Mamina offers a refreshing approach to holistic skincare, focusing on the connection between your mind, body, and skin health. Dr. Mamina has been featured and published in top journals such as JAMA Dermatology, Pediatric Dermatology, and JAAD. Welcome to the show, Dr. Mamina. It's so good to have you here.
So great to be here. Thank you.
Yeah, Happy New Year.
Happy New Year.
Thank you. Thank you. You know, I am so excited to have you on the show because there's so much information out there about skincare at different
Yes.
ages. So I am 63. I'm a newly minted 63-year-old.
Goodness.
And
You look amazing.
oh, thank you. Thank you. And it's, you know, it's overwhelming because back in the day when I was growing up in the 60s and 70s and so on, nobody talked about skincare. Nobody talked
No,
about sunscreen. So I
right.
know I wanted to start with the younger people, but because there are so many women my age who are struggling with what is the best skincare to use for a woman who has sun damage, because we didn't use
hmm
sunscreen until maybe our 30s.
hmm
So what should we do right now with our aging skin?
Yes, very commonly asked question. So even though you feel like there's already been a lot of sun damage, it is never too late ever to wear sunscreen. It's important to keep using sunscreen indefinitely. Any little bit of sun exposure, especially at an older age, will tip things over the edge because you know what the sun does is it gets into the DNA in your skin cells and it can scramble or mess up the DNA. But when we're young, when we're healthy, our immune system have the mechanisms in place to repair the DNA. And, as we get older, though, like after so much DNA damage, then things start to show. And also a lot of our repair mechanisms have been used up. So any little bit of sun is going to tip things over the edge. So the first thing I have to say is wear sunscreen so that you can prevent future brown spots. You can prevent further, development of precancers or skin cancers. So that's the main thing.
I heard somewhere a long time ago that what's done is done. Like, I have the sun damage. It's not going to get any worse. If I have skin cancer, God forbid, it's there. There's nothing that I can do about it.
Well, not exactly. There's some other skincare products I'm going to also recommend as well that can help kind of reverse or repair the damage that has already been done. But because so much damage potentially has already been done, it's important to continue to wear sunscreen because any little bit of sun will only make more damage show up actually more easily. So that's why I always emphasize sunscreen. But yes, in terms of repairing damage, there are definitely some things I recommend. I definitely recommend using a retinoid. A retinoid is kind of an umbrella term for a vitamin A derived ingredient product that really works by increasing skin cell turnover. So it can help kind of refresh, renew your skin. That's also kind of how it helps with acne. So, Retin-A, those prescriptions help with acne, but it also works deeper in the collagen to repair, remodel collagen, and that can tighten the skin, help with fine lines and wrinkles. That's been one of the most studied ingredients.
It really does work.
It works. Like I've seen people's skin who've used it for years, for decades, and you can tell when somebody's been using a retinoid for a consistent long period of time. It works.
I started using Retin-A in 7th grade. So that was, let's see, 7th grade was 1972.
Wow.
So I remember my doctor put me on tetracycline because I had a few pimples on my forehead. As soon as one pimple came out, my mother's like, let's go to the dermatologist, right?
Yeah.
It was on my forehead, typically for a girl going through puberty, anybody going through puberty, right? It starts at the top and then starts going down. And it cleared it up right like that. I did get a yeast infection from the tetracycline.
That can happen.
But I can't believe that people are still using that. And it dries out your skin really fast. So I use it sometimes, and then I stop using it.
Yes. Yeah. So that's the downside of using a retinoid because it does increase skin cell turnover, and that can be irritating and drying for many people. So there's different strengths out there, and you want to use the strength that your skin can handle. There's the prescription retinoids like Retin-A or tretinoin, which is generic. Those have a higher risk of irritation. They work faster, but they are more irritating. There's retinols, which have to get converted in a couple of different steps into retinoic acid or tretinoin. So that's why those are more gentle. They're not immediately irritating. They can be still irritating in some people. But for those with sensitive skin or dry skin, I do recommend starting with a retinol. But the goal is to be able to use it, every other night to potentially every night. I do have to say, though, the other thing to think about in people who are above the age of 60 is that dry skin becomes more common because of the decrease in estrogen. And so you don't have to go crazy. I wouldn't try to push yourself with these strong active ingredients. Yes, I mean, I think it is important to use a retinol or tretinoin, but it's okay if you feel like you can't use the strongest one. You also want to really preserve the hydration, moisturization in your skin. So I really emphasize good moisturization in people who are above the age of 50 or 60 or postmenopausal.
It's interesting. That's so helpful. And I know you are going to throw out so much helpful information today. That's why I'm just so excited to go through all of these things with you, because it is overwhelming, because back in the day, we didn't have so many choices.
Yeah.
And even though it's great that all this information is out there, I am so happy that I found you and that you are sharing the truths and debunking the myths out there, because so many people get pulled in by what one person is saying, and they get overwhelmed. And even again, for women my age, because I have experienced a change in my skin. I had oily skin, then I went to
Mm-hmm.
combination skin. Now my skin is dry,
Mm-hmm.
but I still get a little bit oily. So I'm
Mm-hmm.
grateful for the oils now.
Yeah.
Back when I
Oh,
hated my
yeah.
oily skin. So besides retinoids,
Hmm.
what else is good for somebody who wants to maybe have a plumper, healthier looking skin, but has that sun damage? And do you see
Hmm.
sun
Hmm.
damage in most of your patients who are over the age of, say, 50?
I do, yes,
Mm.
unless they are somebody who, really had practiced very strict sun protection and are very diligent about their skincare and, perhaps have had some cosmetic procedures, whether it's lasers or chemical peels. But in general, yes, sun damage is pretty much the norm in people above the age of 50. So yes, you were asking another ingredient.
Right.
I am also a really big fan of good antioxidant, and one of the ones that has been studied the most is vitamin C. So a
Okay.
topical vitamin C serum that can help reverse sun damage and also prevent future sun damage. And that's something you want to use in the morning because it actually works alongside your sunscreen to prevent DNA damage.
So what does vitamin C do again? Because
Yeah, it's a
I've
potent
read about it, but
antioxidant.
I've never used it.
Yes. So it's a potent antioxidant. And what antioxidants are is they bind to unstable molecules or oxidating molecules. These are molecules that can, because they're unstable, they try to find something to bind to and they can cause damage. So these are also called free radicals. Free radicals are they come about because of some kind of environmental or outside stressor like pollution. UV rays is a huge cause of free radicals, and stress, even certain inflammatory foods. So when you have like these unstable molecules, these oxidizing molecules or free radicals, the antioxidants bind to these molecules and prevent them from doing the damage and wreaking havoc in your skin or in your body. That's why even like, eating, when people say eat your fruits and vegetables, because they're full of antioxidants, there's something to it. They are also, binding to the free radicals and unstable molecules in your body. But yes, on the skin, when you apply like a really well formulated vitamin C, because not all vitamin C's are created equal. That's the one where, people are like, oh, do you have to, do I have to spend a lot of money on skincare? There are some things where you can totally go budget with skincare, but low budget on skincare. But with vitamin C, you know, there are some higher quality vitamin C's that can make a much bigger difference. And because vitamin C is kind of a delicate molecule itself. But yes,
Could you recommend to our listeners right now what vitamin C you would suggest?
yes, I would say like the gold standard is SkinCeuticals CE ferulic. It's
Okay.
C, like the letter C, the letter E, and then the word ferulic, Ferulic. That one's fantastic. I have seen that transform people's skin, people who've used it for years. My office staff, my mom, various patients. Um, Another huge favorite of mine is it's by a company called Skin Better Science, and their vitamin C serum also has a bunch of other antioxidants as well. So very potent antioxidant serum. This one's called
Okay.
Alto Advanced.
Well,
Um,
I'm going to leave all of these things in the show notes so people can find these things. And I
yeah,
like that you pointed out that there are some products you can use that are budget friendly and
yes.
some where you do want to spend the money. And I think
Hmm.
that is also confusing. I do want to get to
Hmm.
that as we go through the different decades and the skin trends,
Yeah,
because again, skin trends are trends. I've been
yes,
in the fitness business for over 40 years and I see trends. And
yep.
I always go back to the women I train. let's go back to old school. Why does old school work? Because it works. They wouldn't be called
Mm-hmm.
old school if they didn't work. And even though the trends, you have to know who you're speaking to make sure that the trends really do work for you, right?
Mm-hmm. Definitely.
Yeah, yeah. So, in finishing up the women over 60 or the postmenopausal woman, and I think it's
Yes.
pretty safe to say that most women over 60 are post-menopause, but not all of them,
Not all.
right? Not all. What else can you suggest to that woman that she puts on her face to help make her skin look better, slow down the look of the aging skin?
Yes. Okay, there's like four other things.
Okay, great.
Um,
Go. I can tell
so
you're excited.
yes, oh my gosh. Well, I get asked this question a lot, and yeah, 'cause people want to know.
Yes.
So another ingredient that I think is easy to incorporate is peptides. So there's a variety of different peptides out there, but the peptides that we want are the ones that can send signals to increase. Well, there's some that can increase hydration and moisturization, which is fantastic. And then there's also some that can also send signals to increase collagen production or collagen remodeling. And I think, there's different peptide serums, but I think an easy way to incorporate peptides into your routine is finding a moisturizer that has peptides in it,
Like
and
what?
using that. So one of my favorite brands, just because I think they have so much science behind their peptides, is Alastin, Alastin.
I've heard of
Their
that.
skin restorative complex is a nice moisturizer with peptides, and their skin regenerating nectar serum, actually, that's more of a it's more of like it's a cross between a serum and a moisturizer, but that one's really nice too. And then Neocutis, they are also known for their peptides as well. Like um, yeah, they have, it's in the light gray bottle. I have to say that.
Okay.
But yes, they make great ones, and
So
yeah,
besides a moisturizer, so look for a moisturizer with peptides, right?
yeah, moisturizer
Okay.
with
So
peptides,
what should we wash our face with?
a gentle cleanser.
Could it be
Depending on your skin
Cetaphil or
type,
something like that?
yeah. So with cleansers, you don't have to splurge. I think
Yeah,
drugstore
I saw
cleansers
your
are
husband
excellent.
using it, right? I think I saw
Yeah,
your husband using it.
yes. We're big fans of Cetaphil. We also really like CeraVe,
Yes.
and we also love La Roche-Posay.
Okay.
Those are great brands that you can find at the drugstore, and they have different kinds depending on your skin type.
Right.
But if you deal with drier skin, which we do see more so above the age of 60, the hydrating cleansers, so the more
Mhm.
cream-based cleansers, as opposed to like a gel or foaming cleanser, you might want to look for like a cream hydrating cleanser.
Right. So moms over 60, or if you're not even a mom, but moms, don't use your 30-year-old's face wash because more than likely your skin is not like theirs.
Yes, yes, look for something very gentle.
Right, right. So we've got
Mhm.
a nightly routine would involve, removing your makeup, washing your face, cleansing your face.
Yes.
You suggest a serum. Again,
Um,
sticking with this over 60, and then I want to go into the other decades.
yes. Well, the basic nighttime routine is cleansing your face, then using a retinoid, and then moisturizing.
Okay.
And then ideally like a moisturizer with peptides. If you want extra hydration, you before your retinoid, you can use like a hydrating serum, something with hyaluronic acid, or you can find a serum that has peptides in it as well. But it also makes me, yes, oh yes, there's
No,
there's
no,
another
because
ingredient I'm thinking about.
yeah, no, I'm super confused about all the serums outside. I've got
Yes,
4 of them in my bathroom, and I don't know which one to use.
I know. I think that serums, the word serums, also, I think people think, oh, I have to use a serum, but serums are just a vehicle to administer an ingredient. There
Oh,
are peptide serums, there's vitamin C serums, there's some retinols come in a serum form. So it's you're not just like a serum is just a way to get it a product. So you don't have to use a serum if you're already using like a cream that has those ingredients too. I do think serums serums, though, the difference between serums and creams is that serums, there's a few things. Serums potentially can have like a higher concentration of the active ingredient, so they may be a little bit more potent, and they may be able to penetrate your skin more effectively. And also because of the texture of a serum, it's easy to layer if you want to incorporate other products into your routine. It's easy to layer over a serum. But I was going to say, when I was thinking about serums, there's, like I said, there's vitamin C serums, which I recommend using in the morning. But another ingredient that I love, and it usually comes in a serum form, that I think is helpful, and especially for women over 60 who cannot tolerate a retinoid because it's too drying or irritating, I think incorporating something with growth factors. So growth factors are also molecules that can send signals to build collagen. And
Can we still build collagen over the age of 60? Is that really a possibility?
you can. It might be a little bit more
Come
difficult, but
on.
you still can. You
Okay.
still can, for sure. Yeah, yeah.
All
Yeah.
right.
Like I said, you might need some help with skincare or with procedures, but for sure. I mean, if you can heal a wound, if you get a cut and you can heal a wound, your body still has the ability to help kind of build collagen.
That's true.
If you can create like a scar.
Right, right. Okay, so I didn't know that about the serum. So everybody listening at home right now, that is the scoop on serums. So try to find a serum based on what your needs are. So for example,
Hmm.
for me, and I'm just using this as an example because a lot of our listeners are my age, vitamin C would be the serum for somebody who's using a retinoid, has sun damage, has drier skin, using the retinoid, the vitamin C, then the peptide moisturizer, and then go to bed.
Well, well, at night, and the vitamin C is for the
Oh,
morning.
morning. Okay,
And
sorry.
yeah, yeah,
Okay.
yeah. So I would say like a basic skincare routine, really for anyone, including above the age of 60, is in the morning, cleansing, vitamin C, then sunscreen. And vitamin C is usually in a serum.
Mhm.
Sunscreen is usually like in a lotion or a cream. And then at night, cleansing, removing your makeup. And then basic would be a retinol, which could be in a serum. It could be in a cream, and then or a gel, and then following that with a moisturizer with peptides. But if you want to take it up to the next level, or if you
Yeah.
can't tolerate a retinol, like if you have dry skin or you're very sensitive to retinols, or if you want to just add something that to really boost your anti-aging routine, is at night after washing your face before the retinol or tretinoin, using a serum with growth factors. That can make a big difference.
Can you give us an example of what would be? I've never heard that,
Yeah.
growth factors. I've never heard that.
Yes, they they're pretty large molecules, so you want to make sure that it's the first step in your skincare routine. But yes, one of my favorite growth factor serums is by a company called Skin Medica, and it's
Okay.
their TNS, like the letters TNS, Advanced Plus Serum. And that would be like the first thing you would put on your skin before your retinol. You could also use it in the morning too. I don't want to get too, I
No,
don't want to get too
no,
complicated
I
here, but
understand. But I mean, what's important, I think, and I'm sure you see a lot of this because we women over 60, like your mom, who has like the most perfect skin in the world, which is what made you go viral on
yes,
TikTok,
that's what made me
right?
go viral
She
on
was,
TikTok. It's my
was
mom.
she exfoliating herself with a banana peel? Her
She was
skin?
just, I think she just thought it was moisturizing. Yeah, she just thought it was moisturizing.
Oh, she's adorable.
But yeah, she cracks me up. But she had been using the vitamin C serum that I mentioned, the SkinCeutical CE Peru. Like that has been in her regimen for the longest time.
Okay. Well, this
Hmm.
is really helpful. Obviously, integrating, and I know you talk about this a lot on your platform is, and you mentioned it briefly, the foods that we eat also affects our skin because with the way
Hmm.
we nourish ourselves are from the inside out. Unfortunately, if you grew up in the 40s, 50s, 60s, and 70s, you probably weren't using sunscreen because I was that girl who used baby oil and had my Peter Frampton Comes Alive album
Nice.
trifold with the tinfoil.
Oh yeah.
Yeah, I mean, that
Oh
was
yeah.
me. I got third-degree burns on my face when I
Oh
was like 20
no.
years old. Yeah. Yeah. So, it's an ongoing process. So everybody who's listening around my age can understand the struggles, because it is,
Hmm.
because it's hard to go back really, really fast. But what we can do, as I tell my clients who are trying to get fitter, leaner, stronger, is, but we can go forward, because there's no,
Totally.
we don't, watch what you eat. It's going to help your skin look better. It's going to give you more energy, but don't focus on the past. Look at what you can do to feel better going forward. And everybody wants to put their best foot forward. And the first thing we see on somebody is their face, right?
Right. Yep.
And
Yeah, no, everyone, I mean, face is a big deal. Your
it
face is
really
a big
is.
deal.
So let's go back to when you're younger. So when
Yeah,
would be the time that you would suggest to patients, to women listening to the show right now, when they really should get serious about a skincare regimen? Starting, I'm thinking, in their late teens, but it could be earlier, right? With acne and so on.
definitely. Yeah, I usually say late teens, early 20s is I think when you want to start doing something pretty consistent, especially incorporating a sunscreen and potentially a retinol. But if you are dealing with acne, for sure, I think it's important to have a good skincare regimen. As young as like even 9 years old, we do see acne
Right.
in kids that age.
Okay. So let's get into the acne.
Yeah.
And so you talk about popping pimples in the triangle of death zone.
Oh, yeah.
Okay, so I also saw on your TikTok that you say pop the pimple. It's not supposed to be there, right?
Um,
Did you
no,
say
I
that?
don't recommend popping pimples, but
Okay.
I did a satire video that said you should pop your pimples.
Okay, then maybe that's what it was. So I don't want to send out the
Yes.
wrong information, because
Yeah.
I always heard that, when I had acne in seventh grade, my dermatologist would take this thing, this, I don't know, this
Hmm.
metal thing, and he would pop the pimples. And, and then I did the regimen he said. So should you pop the pimples or no?
In general, I do not recommend popping your pimples.
Okay.
The trauma from squeezing a pimple or applying any kind of pressure can cause more inflammation, which then can damage your skin further and lead to potentially more scarring or discoloration. So I do not recommend. And then there's also the increased chance of infection too, if you're not using clean fingers or clean tools or whatnot.
Right.
There are exceptions. There are certain pimples that can heal faster if you can drain them, like if it's like a pustule where it looks like it's about to burst open, like you could see the pus at the head of the pimple.
Mhm.
I wouldn't just squeeze it for something like that. You would have to take a clean, sharp, whether it's a needle or a blade or something, to just slightly nick the surface to minimize any pressure for the fluid to come out. Because you don't want to just push the fluid through a closed like surface. You want there to be like an open surface for fluid to come out. So maybe in that situation, that's great. And then of course there's like abscesses, like cysts that get infected and get full of pus. We do need to drain those. Like these are large bumps. A lot of times we'll see them on the back, sometimes on the
Right.
face, on the neck, and really anywhere on the body. But in general, you do not want to pop your pimples. I know some people also will get things extracted. I'm okay with that too. Like
Mhm.
if you have like little whiteheads or blackheads and you just want to extract the contents out, obviously you want to make sure that it's done with clean tools. And it's, done by people who know what they're doing.
Right.
If you're doing it on yourself, just make sure you know what you're doing. Um, but the goal is to really to prevent those blackheads and whiteheads from coming out in the first place, and or to prevent like the pimples from coming out in the first place. Of course, people still will get pimples, will get blackheads and whiteheads, and there are ways to treat them without having to pop them. But yes, but the goal is to prevent them.
Okay,
Yeah.
this is probably a very elementary question, but
Yeah.
what causes us to have pimples? And
Yes.
why do we get pimples at the onset of puberty,
Hmm.
post-puberty, maybe postpartum? I remember I started getting acne in my lower face when I was about 37. I mean, it was nothing. I went on the Retin-A and tetracycline and it went away in like 2 weeks. So it was like nothing, but I remember thinking that was, I don't remember what they called it, but it was like old acne, older people acne. Like to
Yeah.
think that in my 30s I was old, like,
Right,
come
right,
on.
right. But yes, like adult acne. Yeah.
Right, adult acne. So what causes a pimple? Why is it all hormonal? Can you explain everything about pimples, please?
Yes, I'm going to first talk about what are the components of a pimple, like what are the ingredients that turn into like that cause a pimple, and
Yeah.
what are the driving forces behind people
Okay.
getting a pimple in general. So within a pimple, there are three factors that make it a pimple, or that can potentially, that are all involved with the process of making a pimple. So one is oil, or sebum is the medical term, within each pore. So each pore is actually a hair follicle, but on our face, obviously, we may not see hair in those pores, but each pore or follicle, there's an oil gland attached to it. So that oil gland feeds and like nourishes the lining of that follicle. So if hair grows out of it, it like nourishes the hair, but it also like nourishes and our skin. We need the oils in our skin.
Right.
So, but a buildup of oil is one component of a pimple. The other component is a buildup of keratin, which is dead skin cells. So keratin is a top layer of our skin, and it sheds and it lines like the inside of our pore, the follicle. And naturally, we shed our skin, and we get rid of the keratin. But in some people, the keratin people can have a faster buildup of keratin, and that can also clog the pore. So oil and keratin, that's the basis of an acne bump. So when you see like whiteheads, blackheads, that's keratin and sebum.
Okay.
Now, the third component is bacteria. We all have bacteria on our skin, and there's an acne causing bacteria called Cutibacterium acnes, or acnes. And normally, like it's just chilling. Like if it on our skin, it behaves pretty well. But like when it gets irritated by oil or keratin compressing it, or by people squeezing their face or doing something, manipulating their face, or like it like there's a lot of sebum and it wants to like feed on that and have a party. Then we see inflammation. That's when the redness comes out. That's when we see swelling, and that turns more into like an inflamed bump, or I guess classic pimple.
Right.
And byproduct of some bacteria can be pus too. And so that's the kind of the components of acne. But what drives acne are hormones. Hormones, you know, do different things at different points in our life. Of course, as we're going through puberty, like our hormones are doing crazy things and they're trying to figure themselves out. But there are high levels of hormones, especially like the androgens, which include things like testosterone. These drive a lot of oil production and potentially also inflammation too. So that's why we see this huge spike, or this huge rise of acne in teenage years, and sometimes this can go into people's 20s. And then we see a different form of acne as people get a little bit older, later in their 20s, 30s, 40s. I mean, we see acne at all ages, really, but we see like this adult acne in women. We see adult female acne. We can see it more so on the jawline. We see it come out more so around, like there's a cyclical nature to these flares in many people.
Okay.
Sometimes it comes out like right before period, during period. Sometimes it can come out during ovulation, but it's because of
The hormone changes,
variations
right?
in hormones. And we're seeing this a lot more than we did like 20, 30 years ago.
Why?
And that's a really good question. I have theories.
Okay.
I think there's different things environmentally. We're using things that could be affecting our endocrine systems more, whether it's certain plastics, certain chemicals. There's also additives in foods that may or may not be playing a role with our whole endocrine system.
So
And then I think stress plays a big role.
right. And so I'm going to interrupt you there for a second, because when I think about, when you're talking about this, when I think about obesity, right? When I was growing up, again, I'm going back in the 70s, maybe there was one obese person in each grade.
Yeah.
And I went to a school with almost 800 people. So there were like
Wow.
200 in each grade, right? In
Wow.
high
Yeah.
school. And I remember, and as far as large breasts, there was maybe one girl in each grade. But now
Hmm.
you see the large breasts, you see
Hmm.
obesity on the rise. Now you're telling me you see more acne. And it's interesting.
It's
Like,
interesting. We're seeing, yeah, more infertility, more thyroid issues, like other
wow.
endocrine issues, like we're seeing hair loss, which plays a really big role with hormones. Yeah.
So what do you, I know you talk about Accutane a lot, and there's a lot of, again, going back to old school, back in the day, there were very
Hmm.
few kids that were on Accutane, and it's still
Hmm.
around. People are afraid to go on it,
Hmm.
especially when women are still getting acne in their late 20s and into
Hmm.
their 30s and want to
Hmm.
get pregnant or are concerned about fertility.
Sure.
But when is the right time for you to decide, or you decide with your child, for them to go on Accutane, and what are the pros and the cons of it?
That's a great question. And we're actually seeing more Accutane use for a couple of reasons. One is because, yes, maybe there is more acne, but also we're seeing now that we've been using Accutane for however many decades, that it came out, actually was founded in the 70s by
Right.
a dermatologist who actually was one of my who was on faculty at Georgetown where I did my residency, but he
Wow.
discovered the Accutane molecule in the 70s. But anyways, we've been using it more and more, and we're seeing more the safety aspect of it. I think there was a big scare in the 90s where they thought it can induce suicide or suicide ideation, which that has since been debunked. And people also thought it caused GI issues. That
And
has also been
infertility,
debunked.
right?
Yes, that is debunked. It definitely causes birth defects, no question about it. So you cannot take it while you're pregnant,
Right.
but it does not cause infertility. Like you can certainly still have children after being on it. Like
Okay.
if you were on it when you were young, you can still have children later on in life. But the other, but we're seeing that it's actually safer than we thought it was. And we're also seeing more of the detriments of people being on antibiotics like tetracyclines for acne. We're seeing that it has caused a lot of gut issues, disruption in the microbiome. And people will sometimes be on antibiotics for years, which is
Right.
crazy.
Right.
And so there's been a movement to not do that and to start people earlier on with acne. But when a patient comes in and I have to figure out, okay, are they a candidate for acne? There's a couple, or for Accutane, there's a couple of things I think about. If they have like just really just deep cystic acne and it's pretty severe, that is for sure going to leave scars. And so if acne is to the level where it's leaving scars, you want to get rid of that sooner than later because the scars are going to be more difficult to treat than the actual acne later on in life. So scarring, acne, really kind of deep cystic inflammatory
And you can
acne.
tell when that child or that adult has the cystic acne that is going to leave scarring. And even with, I mean, they may be able to, after using Accutane and the acne goes away, have laser and other resurfacing things that can help with it. But
That's
it would,
right.
um,
Mhm.
so how do you know that somebody is a candidate, and how young can they use it, and how old can they use it? And how long is somebody typically on it? And what, lots of questions about Accutane. And what is in Accutane that stops the acne?
Yes. So in terms of who's a candidate, so in addition to people with scarring acne, I also will start on people who haven't responded. Maybe their acne is not that bad, but they still have persistent acne despite being on other medications, despite being on antibiotics or being on other topical meds or another oral medicine that we like for adult female acne, spironolactone. If people aren't responsive, then that's another reason. And I will start Accutane as young as potentially like 11 or 12 years old. I don't do
Wow.
that often. Um, but typically, I feel more comfortable when they're like, above the age of 13. But you could do it as young as 11. Some
Okay.
I can't recall if people will even go younger than that. I don't go younger than that. Um, and you can be however old, you can be in your 60s on Accutane if you
Okay.
want to. It's
Okay.
Accutane can interact with certain medications. So obviously when people get older, they may be on other medicines too. So we always have
Right.
to take that into consideration as well.
Right, right.
Um, and people are typically on it for 5 to 6 months, usually more like 6 months. We dose it based on their weight and how they respond to it. If somebody's having side effects, they may have to be on it longer because they may have to be on like a lower dose, which then kind of prolongs the course because it'll take them longer to reach their treatment dose
Oh,
based
I
on their
see.
weight.
Okay.
Mhm.
So the fears of the things that you mentioned should not be a fear for people who are struggling with acne, who are literally depressed, don't want to go out because they feel like monsters. I mean,
Yeah,
with their face like that.
yeah, yeah.
Um,
So yeah, that's probably the number one reason why I prescribe Accutane. And
mhm,
I consider myself to be like kind of more holistically minded. I really
right.
try to get to the root cause of helping people decrease inflammation in their body. And I know Accutane can be demonized by a lot of people, but there's a time and a place for Accutane, and it has saved lives.
I'm sure.
It makes a huge impact on people's mental health. And for me, I am so thankful for that medicine. But yes, acne, of course we want to like, we want the person to have the best possible outcome. We want them to be in the healthiest state possible, but there's definitely a role for Accutane,
Do
for
you
sure.
normally try to weed out whatever it is first before you put somebody on Accutane?
Yeah, I always like to have a discussion with the person and try to feel out what their goals are and how motivated they are to potentially do other things before Accutane. Some people are like, no, just put me on the strongest thing. I can't continue living like this.
Right.
I need to heal fast. And because really I think there's a huge connection with your gut and your skin, and
Right.
healing the gut is really important. There's also some supplements that can help with acne too. But if you do these kind of more alternative routes, which I'm all for, it just can take longer, and it can take a lot more motivation, diligence, and patience, because you have to like stay away from certain foods, and it may take longer.
Right. What is in Accutane that helps to get rid of
Yeah.
acne? And does
So
the acne ever come back once they're off Accutane?
yes, good question. Well, two questions. So the first one is, what is in Accutane that gets rid of acne? So Accutane is actually an oral retinoid. So we talked about retinoids earlier,
Oh,
which can help increase skin cell turnover to help kind of unclog your pores. So it's an oral vitamin A derivative. But how it mainly works, interestingly, in the oral form is that it shrinks your oil glands. It decreases your oil glands' ability to really spit out that excess oil into your pores. So when people are on Accutane, the number one side effect we see it in 95% plus of people on Accutane, is dry skin,
right.
really dry lips, because it's your oil glands are like actively getting like shut down in a way.
Right.
Um, and I mean, your skin behaves, more normally after you're off Accutane, but that's the main way it works. And in terms of whether or not people have to be on a second course, what's really neat about Accutane is that it's, quote, curative. I mean, in that it can potentially permanently get rid of acne in about 80%, 80 to 90% of
Amazing.
patients who take it. So it's a game changer for so many people. But yes, there's still like 10 to 20% who may have to be on it for a second course.
Okay. Thank you so much for clearing up all that information, because there is a lot of negative information about that, and yet there's so many men and women who need it. So thank
Yes.
you.
Oh, yeah. Happy to
Thank
talk
you.
about it.
Yes, yes. Okay, so postpartum women, do their skincare change? Does it change? What happens to a woman postpartum?
Yes. Well, you know, we tend to actually see more skin changes during pregnancy. Um, because with pregnancy, you get like an increase in estrogen and
I loved
progesterone.
being pregnant.
Oh my gosh, same,
You
same.
just had a baby, right?
Yes, I am 5 months postpartum,
You look so
actually.
good.
Oh my
Congratulations.
gosh, thank you. It's been a
Wow.
ride, but yes,
Has
thank
it?
you.
Yeah.
Yes, I
Wow.
mean, it's been no, it is wonderful.
So exciting.
Yes, yes. But yeah, like I know a lot of women will experience what's called like that pregnancy glow because of that, it's at the increased estrogen.
Okay.
And we have both increased estrogen and progesterone, but sometimes if there's like an imbalance, if there's like more progesterone, that can, some people, their acne will go crazy when they're pregnant. When
Oh,
they normally would have, clear skin, their acne can just kind of go crazy. But then, postpartum, you get this really kind of severe drop in hormones. And we don't actually, it's interesting, we don't really see as many issues with acne postpartum just because of like that kind of huge drop in hormones. But because of that huge drop in hormones, we do see postpartum hair loss. Um, and that usually starts month 3, month 4, month 5.
yeah, I remember that.
Um,
Hair grows, and then the hair grows back differently. It might
it
grow back a little
can.
bit
It
curly. I know
can. Yes.
my hair texture changed a little bit. It's
Yeah.
amazing what those little munchkins can do to us, you
Oh my
know.
gosh. Yeah.
It's crazy,
Lots
but
of changes.
it's always a blessing. It really, really
Always.
is. Do you
Definitely.
recommend for the younger women listening to the show, putting sunscreen? How early can you put sunscreen on your babies?
My rule is 6 months.
Okay.
6 months. So try to do your best to like minimize sun exposure or use sun protective clothing prior to then.
Okay,
Mhm.
sunscreen.
Sunscreen, yes.
I have heard that the only type of sunscreen we should use is mineral based. So none of the other popular, I'm just going to throw out this name, copper tone, for
Mhm.
example, something that's been around. What do
Yeah.
you recommend as the best sunscreens to use? And I know it's very important to also use on cloudy days, which a lot of people
Yes.
forget to do. But what is your
Yes.
recommendation for sunscreens on your face and
Yeah.
body?
Well, let me tell you, there has been so much controversy like on social media, online regarding sunscreens.
Right.
And to me, it's almost like not even worth the headache to try
Jump
to
in there.
convince people. Okay. So to answer your question, if it just so I guess if you just not don't want to have to like stress and deal with any of the controversies that are out there, I would say stick with a mineral-based sunscreen. So that is a zinc oxide or titanium dioxide based sunscreen. And you can find those ingredients listed as the active ingredients when you look at the back of a sunscreen bottle or on the label. Um, just because there's a lot of controversy with the chemical ingredients. These are things that are like harder to pronounce. So like avobenzone, oxybenzone, octocrylene, octosalate, and and in general, oxybenzone has been removed from sunscreens
Oh, wow.
because it has been shown to have some endocrine disruption. The other chemical ingredients, the verdict is still out because there hasn't been any enough evidence to show that they cause harm in humans.
Okay.
There are some where like excessive amounts can potentially cause issues in like other, species like marine life. Um, but there's not enough. So in general, as dermatologists, we still recommend using, whatever sunscreen you're motivated to use that's out there. But I guess for the sake of saving any headaches and any controversy, stick to a mineral-based sunscreen.
Like an Elta MD, is that
So Love Elta MD, all of
okay?
their sunscreens contain zinc, but some are zinc only and some are hybrid
Mm,
zinc and a chemical sunscreen,
mhm.
which is still fine. For derms, we're like, we love them all.
Right.
But if you're the kind of person who wants to stay away from the chemical sunscreens, just look at the back of the label, because there are some hybrid ones from Elta MD. But I mean, some of my favorite ones are the hybrid ones, like the Elta MD UV Clear. That's one of the most popular sunscreens, I think, that both derms wear and that derms recommend is the UV
No, I love
Clear.
that. My daughter's actually turned me on to it.
Hmm.
And is it true that if you find, like, let's just say with Elta MD, they have the clear sunscreen and then they have the tinted. Is it
Yes.
better to use tinted, is that going to bring more is that going to protect your skin more?
The short answer is yes,
Okay.
actually. Tinted sunscreens have an ingredient called iron oxide, and iron oxide has been shown to protect you from visible light. And visible light we're seeing, so like even indoor lighting
Right.
can increase hyperpigmentation, which is a whole nother skin issue that is so commonly complained about.
And happens
Hyperpigmentation,
a lot
whether
during pregnancy. That happened to me.
oh
Yeah.
yes, yep, melasma.
Melasma.
So
Yep.
yeah, tinted sunscreens are great if you have melasma.
Okay.
Mhm.
Going back to acne for a second, and you mentioned it's spiral hair.
Spironolactone.
Yes,
Yes,
yes.
spironolactone. Yes.
So a lot of people are talking about that as as an alternative to Accutane. Is that true? Can you explain the difference and how you're using that?
Yeah, well, it's very different from Accutane,
Okay.
and it's certainly um, a wonderful tool that has prevented a lot of people from needing to get on Accutane, actually.
Okay.
But the way that spironolactone works is it works more on the hormonal aspect of acne. So,
Oh,
there's things that
okay.
work on the oil, there's things that work on the increased keratin, there's things that are antibacterial that work on the bacterial aspect. So this works on the hormonal aspect that's a big driver for acne bumps, and we love it more so for adult female acne. So it's what's called an androgen receptor blocker.
Right.
Androgens include things like testosterone, but it blocks like excess androgens, which sometimes we can see this imbalance, especially right before your period. There's higher levels of androgens than there are the other hormones, and that is what could be driving a lot of the breakouts before periods. And so spironolactone is amazing for adult female acne.
Okay. All right. Because I was confused about how that's being used and if that can be
Yeah,
used instead of Accutane, but maybe that could be a step before you decide to possibly use Accutane, right?
definitely. And it's not, yeah, for sure. We use it. We'll try that. And I don't give it to women or girls until they've had their period. Like if it's a younger teenager and they haven't had their period yet, I avoid it. Would rather people have their period for at least a year before I start
Yeah.
it.
Yeah.
Um, and then we don't give it to men or boys just because of its androgen blocking effect. So we don't want
Right.
to block
Okay.
their testosterone.
That makes sense. Okay. A skincare trend that you think is wonderful that we should all know about.
There was a big one called slugging, which is basically slathering a petroleum jelly-based product like Vaseline or Aquaphor healing ointment, slathering that on your face. And you don't even have to use a whole bunch of it, but applying a layer of it on your face at night. And that has been shown to really trap in moisture and can really cause like glowing skin. It's not for everyone, for people with acne prone skin or oily skin, we don't recommend it. And we don't recommend using it over an active ingredient like a retinoid, because the retinoid can really like get into your skin more effectively actually and potentially cause more irritation.
Okay. Interesting. So that sounds like it would be good for an older person or somebody with dry
Yes.
skin, right?
Yes, it's great for people with dry skin, and yes, older people or people who aren't really having acne.
How does
Yeah.
that differ from Aquaphor if somebody wanted to?
Oh, yeah, either one,
Okay.
Aquaphor or Vaseline. And then CeraVe also has a petroleum jelly-based product, and so does Cetaphil too.
It sounds disgusting.
It
I can't
does.
imagine doing it, but maybe I'll try it tonight because you said it's a good trend.
I
Anything,
approve.
what else is out there that can help improve the texture and the look of our skin?
So another thing, and this is, I mean, I think that everyone can benefit from this. People who are older should practice a little bit more caution, is incorporating some kind of exfoliating acid into your routine.
Okay.
There's the alpha hydroxy acids, the classic example being glycolic acid. There's also lactic acid, mandelic acid, malic acid, citric acid, and then beta hydroxy acids, which the classic main example is salicylic acid,
Right.
which works better for people with oily or acne prone skin because that really binds to oil. But exfoliating regularly, especially as we do get a little bit older, because our skin cells start to get a little bit lazy. Normally we have this skin cell turnover once every 30 days, but it starts getting a little bit lazier as we get older. So
adding some extra help with these exfoliating acids, I would say a couple times a week or once a week, depending on the strength and your skin type, is helpful.
Wow, that's really good to know. I did not know that because I'm not a dermatologist, so I would not know that. And again, there's so much information out there.
So much. Yes.
What about, I just received a Christmas gift from a young man who does my hair and my makeup sometimes. He gave me a snail excretion.
Snail mucin. I was about to talk about that
Snail
too.
mucin. Okay, so it's a trend. I looked into it. Tell me about it. Is it helpful? Please explain to our listeners what it is and what it does.
Yes, the snail mucin is literally like snail excretion, as you said, and that has a variety of different like skin benefits. I don't think it's for everyone. It can potentially make acne worse, but in general, it is full of ingredients that are super hydrating. It has humectants. Humectants draw in water, so it can be very hydrating. And it also has something called glucosamine which are these molecules that almost serve as like scaffolding in our collagen to help build more collagen and also draw in more water. So it has some very lovely ingredients. And then also depending on the product, it can also have some growth factors too. There's a brand called Biopel, their Tensage line, Tensage, has snail mucin, which also has growth factors. So there's some like lovely hydrating and anti-aging benefits from it. And some people, snail mucin can potentially cause acne or clog pores.
Okay,
But
so
in
it's always
general,
really important to know what kind of skin you have. So again, for
yes,
somebody who's prone to acne, it's probably not the best thing. So don't jump on
yeah.
that trend. But for somebody who has dry skin or aging skin like myself, slather the heck of it on my face, right?
Yeah, I'm a fan. I think
My face absorbed it like that. It was crazy. I was like, this is gross. And I put it on there and he said, you're going to go to bed. Your face is going to feel gooey. Oh no. By the time I finished brushing my teeth, it was absorbed.
Well, I do recommend that if you're going to put any kind of hydrating serum like snail mucin, that you seal it in with like a cream-based moisturizer or slugging with petroleum jelly.
On
So you
top
don't
of
want to
it?
just on top of it because otherwise it'll evaporate from your skin. You want to seal any kind of hydrating
Oh,
serum with some kind of occlusive product, like a cream or ointment.
I didn't know that. Okay. So a
Yeah.
lot of what happens to our skin is driven by hormones.
Yes.
You talk about PCOS and its connection to skincare. Can you expand on that a little bit for us?
Yeah, PCOS, polycystic ovarian syndrome, we do see that being a pretty common cause of acne. It's usually adult acne, and and we see it. So it's kind of in the name, polycystic ovarian syndrome, polycyst like multiple cysts.
And when you
You
say
don't
adult acne starts mid-20s. When do you consider adult acne to begin?
usually really anywhere in the 20s.
Okay.
Some people could like stop having acne when they're 15, but then it start again when they're like 21.
Okay.
But but I would say when I think about my patient population, it's probably more so late 20s to the 30s.
Okay.
Is when I see like adult female acne. But yes, it could really be, yeah, anytime starting in the
Okay, so I
20s.
interrupted you. PCOS and skincare. How are
Yes.
those related?
So with PCOS, there is an imbalance with the hormones, and they do have higher levels of androgens. And androgens are responsible for kind of more acne breakouts, especially in the beard area.
Right.
We see some other characteristics of hyperandrogenism in people with PCOS, like they can have hair loss at the top of their scalp, what we call androgenetic alopecia. That's a big driver of hair loss in most people in general at an older age. Like in men, they have like the male pattern baldness, women have the female. Those are driven by androgens in the scalp. And they could have like some other things, like sometimes some facial hair as well. And then sometimes that could be associated with, well, not sometimes, it's often, PCOS is often associated with insulin resistance. So they're at higher risk for diabetes, central obesity, and, having insulin resistance can also be a driver for acne as well. So the androgens, the insulin resistance can drive acne too.
Okay. Wow. We have covered well,
Mhm.
there's my timer. That will be cut out. So we've covered a lot. If you could
Uh-huh.
leave our listeners with a couple of tips or advice or suggestions, what would you say? I'm going to give you, say, top 5 things that our listeners can walk away with and start doing to feel better about their skin or improve their skin.
Yeah. So in terms of skincare, I think washing your face is underrated, because if you go to bed with your makeup, that is a huge contributor to skin issues, skin barrier dysfunction, acne, accelerated aging. So really make sure to wash your face at least at bedtime. That's huge. And then sunscreen, getting in the habit of wearing SPF every day. And it may not seem like it's doing anything, but you will thank yourself in 10, 15, 20 years.
When you're 63, you'll be thanking
Oh my
yourself.
gosh,
Trust
you
me,
will.
ladies.
I cannot tell you how many patients I see every single day who regretted like all the unprotected time they had in the sun throughout their lives. So I hear it every day. And so just to save yourself headache and hassle, sun protection. And if you want to work more on anti-aging, 2 other ingredients that you can incorporate are retinol at night and a vitamin C serum in the morning. And when it comes to just overall skin health, how you are internally also plays a really big role for your skin health too. And in terms of, I don't even know if I'm like, I don't even feel like I'm following the 5-step thing that you're mentioning,
That's fine.
but there's like a few, there's like 4 different things with just overall health.
Yeah.
One is, minimizing stress in one's life, which I know that's a whole nother topic.
Yes.
And then getting adequate sleep. Once again, that's a whole nother topic, but that has also been shown, like less sleep has been associated with acne, of course, accelerated aging. And when it comes to foods, we talked about fruits and vegetables, not only for their antioxidant effects, but fiber is huge, especially when it comes to acne. Fiber is huge. And that's a simple thing. So you can of course, get it from fruits and vegetables with other foods like beans that are rich in fiber. And yeah, those are the
Water.
3 main lifestyle things. And then hydration. Hydration, more so, your body just works better when it's hydrated.
Right.
And in turn, everything else works better, including your skin.
Right. Thank you so, so much, Dr. Mamina, for being on the show. How can our listeners reach you?
Oh, so happy to be here. I am active on Instagram, TikTok, YouTube. My handle is at dr.mamina, dr.mamina. And then I also have a website, drmamina.com.
I want to come see you. Where are you located, by
Yes,
the way?
I'm in New Orleans.
Oh, okay. Well, I've never been,
Yes.
so maybe I'll come and visit you.
Yes, please. It's a place
This
to visit at least once in your life.
Yes, yes. So thank you so much for being on Fearlessly Authentic. I really, really appreciate it. This has just been so much information that I know our listeners will thoroughly understand and go out and get all the products. I'll leave them again in the show notes. Thank you so much. And for everybody listening, remember to rate, review, and subscribe. You can find me on Amazon Music, on Apple Podcasts, Spotify. Follow me at Jody Harrison Bauer on all social media platforms and on YouTube. So thank you for listening. And until next week, go be your most fearlessly authentic self. Bye-bye, everyone.